Welcome to the Maddie's Fun webcast, all about advancements in neonatal kitten care. I'm Monica Tarant, Chief Innovation Officer with the Give Them 10 movement, and it is a huge honor today to be here with two of my favorite people talking about advancements in neonatal kitten care. Our guests today are Dr. Julie Levy, the Fran Marino Distinguished Professor of Shelter Medicine Education at University of Florida, and Marnie Russ, one of our nation's leading experts on neonatal kitten care. Dr. Levy focuses on the health and welfare of animals in shelters, feline infectious diseases, and humane alternatives for cat population control. Among so many other distinguished accomplishments, she is the founder of Operation Catnip, a nonprofit cat neuter return program that has spayed, neutered, and vaccinated more than 80,000 cats in Gainesville since 1998. Dr. Levy is joined by Marnie Russ, a recognized expert on caring for at-risk kittens. As the National Kitten College Program Administrator at the Animal Welfare League of Arlington, as well as the founder and executive director of National Kitten College, Marnie recently launched a self-guided course on Maddie's University called Taking the Fear Out of Bottle Feeding and Basic Kitten Care. This course helps foster caregivers raise happy, healthy kittens. Marnie also assisted UC Davis in drafting the updated neonatal kitten care guidelines that were released late last summer and will be discussed later in the webinar. By the way, Arlington has the first kitten nursery of its kind. It went from saving 92 kittens in a year in 2016 to almost 1,600 kittens in 2023. In 2023, several major shelter programs and animal advocacy groups updated their guidelines for caring for neonatal kittens, often adding confusion and debate about the best way to care for underage kittens. And we're going to go over some quick definitions now on our screen to set the tone for this really cool webinar that you're going to hear. So for our purposes today, neonatal kittens are any kittens requiring care to reach the age of sterilization and/or adoption. This also includes kittens with their queens. This presentation is going to discuss the evolving plight of neonatal kittens in the United States, but we're going to be talking mostly about healthy kittens or healthy-ish kittens, the majority of those coming into shelters. We need to differentiate what kitten care looks like, though, between what high-volume kitten care looks like. This is going to be primarily focused for shelters who've got a lot of these kittens coming in the doors, and we need standardized protocols. And that differs a little bit from how an individual might be caring for one kitten. This is going to be for shelters and high-volume kitten care. We're going to be looking at how kittens in need come to us and how shelter medicine recommends their care. We look forward to challenging how we've historically defined neonatal kitten care in shelters and rescue for decades. I have a ton to learn on this subject, and I cannot wait to hear these amazing updates. So Dr. Levy and Marnie, please, let's learn what's a better way to do things and what is here to stay.
Thank you so much.
Thank you, Monica. I want to start really high level. All of the cats that are confronting our shelters and our rescue groups and individuals who love cats, and talk about how we can wrap our heads around developing pathways and removing decision fatigue around large populations of cats. We are talking to a lot of shelters and rescue these days. It's a really hard time for everyone. The post-pandemic landscape is getting harder and harder. We're still not having enough spay and neuter, which means we're having so many kittens that are flooding into our shelters and our rescue groups in really overwhelming capacity right now at this time of year. And in this year, 2024, it seems like it's been especially difficult. We have to find a way to scale up our responses and create high pipeline avenues to manage all of these cats and hopefully take most of them to positive outcomes. So in our shelter medicine program that we share with UC Davis and Maddie's Million Pet Challenge, we've developed this concept of cat superhighways. And our reasoning is that for the most part, adult cats that are thriving in their neighborhoods should be mostly neutered and returned to those neighborhoods. That's the superhighway for adult cats that are thriving out in our neighborhoods. Now, kittens have a high mortality rate in the wild, and so we know that they are not yet established in the neighborhood, that a lot of them are going to suffer from severe illness or maybe even pass away. And so our TNR programs are really not the best response to kittens. And so we need a high volume pathway for kittens, a superhighway that gets them to a new home, but not through a shelter. We don't want to clog up shelters and put kittens at risk for shelter-acquired diseases and other problems that shelters have. So think of this as a starting place of high volume TNR for the adults, high volume kitten shelter diversion for the kittens. And that's really the kitten pathway is what we're going to be talking about here. And I'm sure you can all relate to this. This is a map. We said we told ChatGPT, artificial intelligence, to make a map of a cat superhighway that encounters all of these different things, these kinds of people who are running into kittens and wanting to help. And this is exactly what it feels like, right? It's a maze, it's a mess. There's all these different stakeholders. We don't have enough programs for all of these. And how they have, go ahead, Marnie, how they've typically gone through shelters is all of these cats are going through animal shelter as the one major pathway. Go ahead. So regardless of where we found cats and what they really needed, traditionally we've said, take them to the shelter. And that's what the public understands. If you have a cat problem, whether you like cats or don't like cats, you take them to the shelter. And shelters traditionally have had three options: returning them to the owner, which we know occurs very infrequently for cats; adoption, we're getting very good at adopting lots more cats, but it's still not meeting the need; or euthanasia. And unfortunately, cats have always outpaced dogs in the amount of euthanasia in animal shelters because there just hasn't been enough capacity for good outcomes if all the cats are flowing into shelters. And so what we'd like to do is fix this picture in your mind. Don't read all of the little intakes and outcomes. That's not the point. What you see, though, is the pathway going to the shelter is very narrowed. And what we have instead are two very large pathways on either side, one for the adult cats to go back to the field after being neutered, and the other one for kittens to go into good adoption homes, but bypassing the shelter entirely. Okay. And what you might be able to see here on this summary is those highways have little off-ramps on them. And that's because there's always exceptions too. So we don't want to take all of the decision-making and assessment out of the scenario. We have these major pathways, but we also have off-ramps for, say, the adult cat outside who's not thriving. Maybe it was lost or abandoned. That cat needs to come into the shelter. But if we don't have an overcrowded shelter, the shelter will be ready to meet its needs, or to save room for the cats that need to be owner relinquished for, owner going to the hospital or passing away. We have to find those cats a good outcome. Shelters are perfect for that. And they'll have room to take care of those cats if we're not crowding it with all of the cats that don't need to be there. And the same with kittens. Sometimes our kitten shelter diversion programs are overloaded, over capacity, or maybe the cats are already too shy. So we want to focus on big superhighways, but then having enough nuance to these management that we are looking for the right outcome for every cat. Every cat gets what it needs. So this is our summary here. Adult cats, healthy cats, mostly going back to where they came from after neutering. For those that can't thrive outdoors, they can come to the shelter. Cats that can't be adopted and are can't go back where they are. Maybe we don't know where that is. Maybe it's an unsafe environment. Those go to our working cat relocation programs. But then we have the kittens. They're in huge numbers, and we want to fast track those kittens to adoption, but without entering the shelter. And that is what we're going to focus on here today. So I want to take a moment to talk a little bit about how shelter medicine is similar and dissimilar to private practice. And I wanted to bring this up because a lot of rescue groups and foster programs are going to be working with veterinarians either in shelters or in private practices, and they may be getting different information or having different recommendations from those two. And so we are all colleagues, and a lot of veterinarians work in both of these sectors or move from one to the other throughout their career, but there's still some differences too. And for example, private practice veterinarians have usually not been trained on how to respond to large populations of animals. They're exquisitely trained in individual animal care. They also have to work with an owner that has their own needs and resources, whereas in shelter medicine, we don't really have to individually tailor our care with an owner involved. We have an organization we're responsible to, but we have more control over decision-making in shelters than a private practice would. And so shelter medicine, sort of by definition, is dedicated to the care of homeless animals or those that are at risk of becoming homeless and keeping those animals healthy, hopefully preventing them from coming into a shelter, and then getting them as quickly as possible to their right outcome. But we also have different context often, resource levels, scope, different stakeholders that are interested in our operations and our outcomes, different risks, like private practice veterinarians usually don't have a risk of a panleukopenia outbreak occurring in their practice, whereas a big shelter with a lot of kittens always has that risk and has to be operating at that risk. Private practices don't usually have to respond to cat advocates in the community who want to have a say in how the shelters are being run, whereas shelters are facing that every single day. And private practices usually have a little more control of the number of animals that come in and when they come in, so that they are ready to meet the demand, whereas shelters typically are really facing more animals that people want to bring to the shelter than we can possibly care for appropriately. And yet we don't want to turn animals away that really need it. So there's very different tensions in these kinds of practices. I'm really proud of veterinarians who work in shelter medicine because they are some of the most courageous and curious and creative veterinarians I know. They can solve problems that we didn't know could be solved just by being brave and trying something new and keeping good records. And look at all the hearts that are coming. Thank you, everybody. That warms my heart too. I'm glad you feel like that. And so we often make advances in shelter medicine that the private sector hasn't heard of yet or they're not familiar with. And it often starts with a veterinarian just trying something kind of crazy or borrowing something from large animal medicine or a different field, human medicine maybe, trying it out, MacGyvering with what they have. And then we start to see some trends. Shelter medicine veterinarians have discussion groups that are very vibrant. We're sharing information and helping each other all of the time. So we start to see these things that look promising. That leads to real shelter-based clinical research, and eventually the development of evidence-based guidelines, which we share out with all of you, like the Association of Shelter Veterinarians guidelines for shelters. So that gives you a bit of kind of background about why sometimes private practitioners and shelter medicine practitioners are not always on the same page. We want to work closely together and to bring each other up because we need each other, right? Like the shelter needs to rescue the animal and then they need to hand it off to a veterinarian who understands what it was that we did to this animal for a lifelong of care. So we're constantly working on trying to educate each other and get together, pulling on the same team. I think what is really unique about shelter medicine, especially these days with very crowded shelters, is that we are refining specialized practices to elevate the level of care at scale. And we're going to talk a lot about what at scale means today because the kittens need us. There are tens of thousands, if not hundreds of thousands of kittens out there right now that need help. We have to be able to scale up our kitten rescue programs to, one, have better outcomes for all of them, but also admit more to them. When our programs are too intensive and cumbersome to accommodate all of the kittens that need help, we are missing an opportunity. So I think a lot of you have probably heard about high quality, high volume spay neuter. We invented this term over a decade ago when a group of spay neuter veterinarians was brought together by PetSmart Charities and the ASPCA to develop more support for high volume spay neutering. And so 30 to 50 animals per day getting neutered in standards of care that often exceed those in private practice. But it was a concept that wasn't being well accepted across the veterinary profession. And so we developed guidelines. We developed this sort of cumbersome term, but we've come to love it. And so there's lots of data now to show that the outcomes in these high volume spay neuter clinics are very, very good, often exceeding those in private practice. And we've also are now starting to export this concept to other things that we do frequently. So we've got several studies going on in what we would call high quality, high volume heartworm treatment. And I want to propose today that what we're going to be talking about is high quality, high volume neonatal kitten rearing.
Thank you so much, Julie. Now a little bit about Kitten College and why we're here. Kitten College was developed in 2017 from a grant that we got at the National Kitten Coalition. We received a grant to visit the 5 major shelter nurseries in the country and spend 2 days with them and create a document that talked about lessons learned, how to adequately do a high volume neonatal kitten program. But while we were in these meetings, I kept thinking, you know, this is absolutely wonderful for kittens that end up in these urban areas, but the majority of kittens are going to land in small to mid-sized municipal shelters. So what does this look like in a small shelter? I happen to live across the street from the Animal Welfare League of Arlington and had fostered for them for years. I brought the idea, and we worked closely to create a program that had no boundaries. And what that means is we did not define what the program would look like, because I knew that I wasn't sure what it would look like. I didn't know if it would be in-house. I didn't know if it would be foster-based, but I knew that there was a need. So in July of 2017, we launched the first kitten nursery program in the DC metropolitan area. Prior to that, Arlington is a very wealthy urban area, very transient. Lots of people come and go with the administrations due to being nestled right next to Washington, D.C. But I knew that the areas around us were euthanizing at 9:30. So the program we were no different than any other program that's probably listening today. We just tried a few different things and we had maximum impact. So we went from going to from 92 kittens annually in Arlington to over almost 1,600 last year. We also went from doing only having 38 fosters to manage the numbers to over 300, and 100 of which of ours are bottle babies. And I can't stress enough how important it is to realize that we are no different than any other area. We were a smaller shelter trying to figure out how to handle kittens. We are very fortunate in our demographics that we're able to help outside of our county borders, but anybody can do what we're doing. Upon all the successes of our program and our polling at such a high number, we decided to work with the counties we were pulling from to develop what we called satellite campuses, meaning we would go in and help them develop programs on site so that they could keep the kittens in their community. But they had the affirmation from us that whatever they couldn't take, we would house for them. And that was a huge incentive. So that really enabled them gave them the motivation to create these programs. After that, we started going around the country. We now have 25 plus campuses. It doesn't take much to be a kitten college other than the want to be, to save kittens. We offer all of our services at free, take what you want, take what doesn't work. We just launched nationally on July 1. So the Kitten College program itself will always be at the Animal Welfare League of Arlington. This is our home base. This is where we see what goes on with high volume kitten care, but the educational component needed a bigger platform. So we now work all over the country, working hand in hand with the Animal Welfare League of Arlington. You can learn more about Kitten College if you want on our website. We'll talk a little bit more about that later. But we offer everything at low to no cost to shelters and rescues. So basically, that's essentially what Kitten College is. 2 parts. One is at the shelter, one is teaching outside our shelter walls. But the whole reason for this is because we know that underage kittens are the most euthanized animals in shelters across the country and have been. We also know that they are the most adoptable once they reach adopting age. So our goal is to work with shelters and rescues and get those animals to bridge that short gap. So like we mentioned earlier, we did do updated guidelines. We sat on a panel with folks from UC Davis and University of Wisconsin last year and updated the guidelines for underage kittens. It had not been updated in over 10 years. And I was presenting with them at a conference, and they asked me about some of the things I said. And they were like, we didn't realize that ours had not been updated. So they invited us in to help with making those adjustments. It is now available through this website. It's also, the link will be put in the chat and sent out. The other additional resource we talked about is the Maddie's University course. We finished that. I think it dropped in March. That is taking the fear out of bottle feeding and basic kitten care. My main goal for that was to make it so that people who were volunteer or foster coordinators could use it as a training tool. It is tested. They will get a course completion, and they also can ask any questions they want throughout the course that will go directly to me. It was important to have questions be able to be answered before animals were taken into their care. So basically now we're going to talk about some of those guidelines. Now those guidelines are very large and they go over quite a bit. What we're going to talk about today are the main ones that we get questions about out on the field. And what you'll learn today is going to blow your mind, I hope. It's going to increase your number of fosters, which I know is a main issue for most programs. It's going to make the kittens healthier and happier. They're not going to be stressed. When they're not stressed, they don't get sick. We're going to talk about the loss or how to minimize diarrhea and what some of these practices do in making very highly social kittens. So hopefully you find this very interesting and your program is able to benefit from it. So the most important thing that seemed to resonate when we launched this is the feeding schedule. If you look back historically on any shelter medicine program and anything Maddie's Fund has, anything, nowhere can we find anything that says feed kittens every 2 hours. Yet we all know that term. Like if you have a bottle baby, you feed every 2 hours. And yes, frequent feedings are very important. But the schedule is going to vary based on the kitten's age and their health, how long they've been on the bottle. Kittens feed much differently on the bottle than they do when they're on their mother. So you'll think about them suckling a finite amount every time they nurse. But when we have a bottle, they get a large volume all at once. And that volume stretches their stomach. They can go much longer in between feedings. And what we want to do is not wake a healthy kitten to feed it. Sleep on a healthy kitten is just as important as nutrition. They are growing at such a rapid pace, and it's stressful to them if we wake them up to feed them, and their GI system is not ready for that. UC Davis did a very good study a couple of years ago, Dr. Berliner, regarding the mortality rate and the rate of diarrhea in overfeeding neonatal kittens. So the information seems to be there, but for some reason we're having a hard time getting it out to the people. And it's important for two things. We do know that it's very important to, let these kittens grow and eat and thrive as they will. And usually that's with longer ones. But also when we tell people that want to foster kittens, they have to feed every 2 hours, we lose them as fosters. And we need to let them know that, there are ways to do this to make it fairly easy. We have kittens that will come into the shelter that have not had food in 24 hours and they're fine. And of course, we absolutely don't want that. But if somebody were to fall asleep in the middle of the night and kitten got up and was hungry and had to wait an hour or 45 minutes or whatever, we don't want that. But if that happens, that's okay. A good rule is just try not to wake a sleeping kitten for a feeding. We also know that kittens sleep much deeper at night, even though they are blind and deaf little mole critters when we first get them and they're little. Vibrations is what they feel. And so opening and closing doors, walking, phone ringing, they will feel those vibrations. At night, the world quiets down. So you will see kittens sleep a little bit longer at night. And we're very, very fortunate that we don't have to guess on whether or not our kittens are getting the nutrition they need. Daily weight checks will tell us kittens should gain weight every single day. If they're not gaining weight or not gaining it very rapidly, add a feeding. But you're able to monitor it and know those kittens are okay by whether or not the scale goes up every day. So basically, we're just really trying to make it easy for people. I don't want to know the person that doesn't want to be a bottle feed a baby kitten, but they may be out there. But everybody who wants to may be more inclined to do it, knowing that it's not as harsh of a schedule. So we get a lot of questions about, okay, so what is the daily feeding schedule? And I will tell you, I say this a lot because I have a twin brother, and I always say that he's 6'2", I'm 4'11", and we're a litter. And he has always eaten way more than me. Always. He always will. He always has. So kittens are going to be individual in what they eat and how quickly they gain, as long as they're gaining. This chart, which will be put, they're putting up as well, a link to this on Maddie's Fund. This, I think, was from like 2012 or 13. It's fairly old, but it shows you at no point did shelter medicine or any sort of research area to determine that you need to have 12 feedings a day if you're a healthy, thriving kitten. So this is a great place to start. If you got in a 2-week kitten, start with 7. If their stomach stretches and they can go a little bit longer, just try and stay in that range. So another thing we're going to talk about is temperature regulation. When I first started this, I was always taught that kittens have a temperature of 100, 101. You want to make sure that that's what their temperature is. But kittens do not. Kittens need to be kept warm because their body temperature starts at 97 degrees. They won't reach what their adult body temperature will be until between 3 and 4 weeks old. That's why we say kittens can't regulate their own body temperature. This is why we say keep a heat source with them, because they are building up their temperature slowly as they grow. At 93 degrees, and if you give a cool kitten food, they will not be able to digest it. At 89.6 degrees, their organs will shut down. It's important to remember that if you want to feed a kitten, feed a warm kitten, never feed a kitten that's cool to the touch. So most kittens are not going to need you to regularly check their temperature, but if you feel a kitten, you feel like it's cooler than you, assume that it has a low body temperature and check it. For ambient temperatures for the nest, this is something that a lot of people have started getting incubators or they're putting kittens in a bathroom and they want to make sure it's really warm. You want them to have an area where they can reach 86 degrees. So that is a heat source that they can get next to, and it's warm for their 1 week and under. At 2 weeks, that can go down. At 3 weeks, it can go down to 77. All of this information was done in a course by Dr. Emmanuel Fontaine. We put the link to that course in here as well. It was very interesting about young kitten care. Julie?
So this is a concept that I've struggled with for the longest time, is what to do about combining kittens or how to best raise a singleton kitten. And coming from my background, which is primarily focused on infectious diseases, especially retroviruses, which are not apparent at the time, just looking at a kitten, is how do we balance the risk of putting kittens from different sources together and maybe spreading infectious diseases to the healthy kittens versus either just overwhelming your foster homes that can only have one kitten at a time, or if you have a queen with the litters, it's safe to put another kitten into that litter. And then also the concept of, kittens are herd animals. They get very stressed if they are separated from the rest of their group. It's a survival instinct to stay in the pile with their litter mates. So living alone is very stressful to a neonatal kitten. Also, we've all raised some singleton kittens, and they have a high rate of being really obnoxious adults. They play rough. They're not properly socialized by bigger, more well-mannered cats. And they can be bitey, scratchy, pouncy. Oh, I see. Yeah, lots of people laughing and crying, and that they've all been through that. So what we'd like to do is come up with some kind of metric to decide, where on the risk-benefit scope should we land for trying to balance the best of both worlds, not having to have individual healthy kittens that are alone versus putting other kittens at risk. And this is actually how I first came back together with Marnie again, was I accidentally came across that great new manual that is hosted on the UC Davis website that she was just describing. And I was just down a rabbit hole in the middle of the night reading about it. And she talked about putting kittens together. And we've always kind of taught that that's never appropriate to do because of the risk. And then she went in the document, it goes through this risk kind of mitigation analysis about how much risk we would cause by putting 2 kittens together. And really, from a point of view of infectious disease, if we put 2 kittens together, we are risking the life of one other kitten. So the benefit of 2 kittens, but maybe putting one other kitten at risk if the other kitten is carrying an infectious disease. On the other hand, if we take that one singleton kitten and put it in with a whole litter, we might be putting 4 other kittens at risk. And this just was such a logical and simple way to think of it. And so I really wanted to share that today, because I do think that very often we can put 1s and 2s together with not with 0 risk, but with low risk, and that the benefit that we get from that is worth it. So our kittens are going to get They're going to be healthier. They're going to have better socialization. They will be less stressed. And we know that everything about stress in kittens is horrible and deadly for them. So making them more comfortable and secure in their very early life is really important. And then also remember that the critical socialization period of kittens is 2 to 7 weeks. It's very, very young, younger than dogs. So we need to do everything we can to keep the kittens comfortable and getting socialized during that period. And then Marnie put a note in here. I'm actually going to ask her to explain about the quarantine concept because we didn't get a chance to talk about that.
Okay, yeah. So at our shelter, what we do is, we'll have, if we have healthy kittens that come in and we know they haven't had any exposure, then we will lower the risk, we'll lower it from 14 days. It had always been a 14-day quarantine to lowering it to between 7 and 10 days, as long as they don't have risks of having exposure or have any acute symptoms. So if we're able to lower that, it's better for the kitten. And then it's also, it would free up a foster home or.
Absolutely. And then the other note that I had in here was your pair buddy doesn't necessarily have to be another kitten. We have dogs that often are very good as kind of nurses for the kittens, very protective. They'll groom them, they'll cuddle them. And then sometimes we might get a neutered male cat or another adult cat, maybe even a queen that just doesn't happen to be lactating, but she's still a real good mom and will keep them clean and comfortable. So we, think about those other ways that we can add some security and comfort to the kittens that we're raising. And then the weaning from the bottle. So this is another process that I've seen some questions that came up about how do we know when to wean? What about the ones that are resistant being weaned? What's too early? What if they're sick? And I think there's some really good guidance here. We need to remember that the kittens are individuals, just like the ones that all have different feeding schedules that they want. They are all going to mature at a different stage and get their adult life skills at a different sequence, even within the same litter. And not surprising, like, Marnie and her twin brother should be, you would think they'd be very similar. And actually, they're not. They're complete individuals and they have had different lives and different growth patterns throughout. And our kittens are the same as well. So one is take your lead from the kitten. A kitten that is absolutely refusing to eat, pushing the food away, just doesn't get it, is marching through it and getting it all over the fur, but nothing in the mouth. That kitten is telling you it's just not ready yet, or maybe it needs some training to really make this transition. In general, we start to see that kittens want to be eating or at least walking through food at that 4 to 5 weeks. And it is important when you're going through that process to make sure they're actually eating it and not just sort of face planting on it, because sometimes they can be thinking about eating it, but not really being effective about it. And that's where monitoring that weight every day is your clue to whether they're eating effectively. It's a good rule of thumb that if they have not yet mastered the litter box, it's probably too soon to start trying to teach them anything new. I think the best thing about cats in the whole wide world is they are naturally litter box trained. So different than puppies. If you've ever had to raise puppies versus kittens, you all know what the difference is that puppies just finger paint in the poop and the kittens are very fastidious and they will try to use a litter box. And then so chewing on the bottle, aggressively suckling, pushing the bottle away if they used to be nursing well, or just showing signs of interest in the food that the mother cat might be eating are all good signs to start working on, starting to offer them gruel or syringe feeding or other, more solid foods. But then make sure that you are continuing to offer them the bottle during this process, because it's not going to be an overnight transition. It will be a transition in which they slowly replace the fluids and the nutrition they're getting from the bottle with what they're taking in orally. So there's a lot of judgment in how much to continue to offer them. But again, they will have they will lead the way and tell you. You can expect some a regression in the quality of their stools. They may have some diarrhea or even constipation. They may slow down their weight gain a little bit as they're making this major physiological transition, but it should not be severe and they shouldn't be acting sick. And again, that weight gain every day tells you that you are on the right track. And just remember that they are all individuals. Some are going to get this really early. Some are going to take longer. There are some kittens too that do seem to get addicted to a bottle, and they just, grow up into be cats, and they will not stop eating. And those ones you will need to develop a plan for, to really train them to eat and have a little bit of tough love with making them hungry. But I think that really is the exception to the case. Most kittens are naturally interested in learning how to eat. All right, what about spay and neuter? This is one of my very favorite topics. We've done a lot of research on spay neuter, TNR, adult cats, kittens, anesthesia, payment, like all kinds of things that we've studied on spay neuter. And so the thing to know, we're talking about healthy cats in this session, is that medically, a skilled surgeon can very safely spay and neuter kittens as early as 6 weeks or 1.5 pounds, really even earlier, but we don't really want to be bumping into their time when they're not really weaned yet. But technically, from a surgery perspective, this is very technically easy and actually delightful, because there's hardly any blood and they wake up really fast, and everything is just small and fast. And from a surgeon's point of view, very easy. The other thing to know that is not always understood by private practitioners, and we've done the research to prove this, is kittens will respond to vaccination at the time of spay neuter on that same day just as well as they would if you were not doing surgery. So there is sometimes a thought that is taught in vet school someplace that you should not vaccinate animals at the time of surgery because it is stressful and they won't respond, and that's not true. So know that because we're all busy, and probably you're scheduling a lot of your appointments for medical care at times when they are due for vaccine, that's just fine to give it at the same time. Now, emotionally, we don't have as much data about this, but based on what's known about surgery in babies, as well as what's important about kitten socialization period at 2 to 7 weeks, it is very, very important that we do not frighten or cause pain to neonates of any species, because they are very susceptible to imprinting, and that can cause them to regress in their socialization. It can cause them to be fearful adults. It can cause them to be very difficult at the veterinarian if they associate that frightening experience with a veterinarian. So as we're building our shelter protocols for how we deliver veterinary care, whether it's just for a wellness and vaccine visit or whether it's for spay neuter, is let's really embrace those fear-free training principles of working with the cats, not manhandling them, looking for signs of fear, anxiety, and stress, using enticements like treats at the time of vaccination, and then making sure that our spay neuter protocols themselves have good anesthesia, recovery, and pain management protocols built in, so it is not a negative experience when they go to the vet. Marnie did some surveys that looked at when shelters tend to be doing spays and neuters, and it looked like the average was about 8 to 10 weeks or 2 to 2.5 pounds. I think that's what I've heard as well. A lot of big shelters with shelter medicine veterinarians really try to pin it lower, like kind of 8 weeks, in my experience, is what we aim for if the kittens are healthy, and even younger if we're starting to get bottlenecked on flow through and the kittens are healthy and we can just get them moved on. So keep it really young. The good news is earlier sterilization allows the shelters and the rescues to save more kittens, because we're putting more animals through our pipeline, right? We're scaling up saving kittens, because behind those ones that we can see in our care are a whole bunch more that are not getting care yet and are at very high risk where they are. The bad news is we're all struggling with a post-pandemic surgery backlog. There's shortages of veterinarians working in shelters and spay-neuter clinics. There's less capacity in private practices to help rescue groups get their animals done, and it's getting more expensive. And so even though we have been proponents for decades of neuter before adoption for every animal that goes through our care, we have cracked the door open in this time of veterinary care shortage to placing kittens in their new homes with contracts or neuter before adoption arrangements or other less than perfect arrangements for neutering, because what is worse is having an animal that is out in the streets not getting the care it needs from us. And this is really controversial, and it goes against a lot of what we have preached for a very long time. but we have to know that the cats that are out there not getting into our care are reproducing tons more than the ones that we might place without adoption, without being neutered for adoption. It's not ideal. We know some are not going to comply. We know it's more work to get them back, but let's look big picture here and how we can help the most animals possible. Hopefully you are not confronting this. If you have good spay neuter vets now, take good care of them and bring them cookies because you want to keep them in your operation. And then finally, I want to let everyone know about the Fix by 5 initiative. Obviously, we want to neuter cats more like at 8 weeks, but globally for pet cats everywhere, for veterinarians who aren't there yet in their comfort level in neutering really young animals, there is an initiative called Fix by 5 that all of the major veterinary organizations have signed on to. So the AVMA, the feline practitioners, AHA, and others, several state veterinary associations. And its goal is to get veterinarians and owners to understand that all cats should be neutered by 5 months, because at 5 months, they're starting to reproduce already. So they're just trying to back down that private practice concept of, currently people are recommending neutering from like 6 months to a year, and we want to back that down to below 5. So if your veterinarians need that kind of information to share with your community, then you can go to this website and get information that you can share for educational materials. But for shelter work and rescue work, we're really working much younger than that.
Okay, so I believe this one is me. So fostering post-pan loop, one of the things that I have been doing when I've been traveling across the country and talking to folks is shelters are seeing a lot of pan loop, which is unfortunate and something we all have to deal with. But one thing that we need to kind of take a look at, and it's under that same lens of shelter medicine versus private practice, is what do we do with a foster? Maybe it's our best foster that inadvertently got a kitten that came back with a faint positive and you quarantine them, things don't develop. We really want and encourage shelters and rescues to look at ways in order to maximize those fosters' uses without cutting them completely off if they have had a pan loop case. One thing that you can do that we do sometimes with ours is if we have pan loop, we will use that home. We have so many kittens, we often have several either exposures or actual outbreaks with pan loop. That home for that season will be a pan loop exposed foster home. But we also have some of our best fosters that come in and they get a kitten that has pan loop, and we as a program, it is a huge detriment to our program if we don't allow them to foster for 6 months. So we really encourage folks to look at the risk versus benefit of alienating a foster home for the possibility of an infection versus, a safe home with kittens that we're able to take kittens if we have a place for them. Those kittens won't be euthanized. So sanitation protocols, we know how well those work. We know that sanitation is extremely effective when done properly. We often recommend when we talk to shelters around the country, we say, trust your fosters, teach them well, give them a slight break, but doing 6 to 8 months for pan loop fostering is something that really only hurts you. If you trust them, if you know that they're capable of keeping with sanitation protocols, then reintroduce kittens to them if it means life-saving. So really just look at that risk versus reward when dealing with pan loop, post-pan loop.
So important. Well, I'm going to buzz through a few quick updates that some of which are coming on the horizon, some of which are here now, but something all of you kitten people should be aware of. So first is some progress in the treatment of feline parvovirus, panleukopenia virus. It's obviously a major threat in crowded shelters. We're hearing about outbreaks all the time. Mortality is really high. The best thing you can do to prevent panleukopenia outbreaks is to keep kittens out of shelters and put them in high quality, low stress foster homes. Really, it's just one more reason not to have kitten nurseries and other high volume, intense housing for kittens. It's just so high risk. if you have a really good ICU care for kittens and good veterinary costs, you should be able to save about 90% of the kittens, but most rescue groups and shelters don't have that. They just don't have the capacity to do ICU level care. The good news is, some of you may have heard about the new canine parvovirus monoclonal antibody treatment that is out for puppies and seems to be helping in shelters. We're still figuring out which puppies respond the best. It's very expensive. What is the best way to use that resource? And the good news is also there may be some reasons why to think that it might help kittens too. Now, there's no research on this yet, but there's some theoretical scientific reasons to be kind of excited about it, to start working on research for this. But the bad news is it probably won't be as effective in kittens as it is in puppies because it is a canine antibody. So just keep your ear to the ground about this coming down the pike, and we'll do our best to keep you updated if there is any information. You can read about this new treatment for puppies at the Elanco website. And then FIP, I probably everybody by now has heard that FIP treatment is curative and available in the US as of this month. I do want to stress, though, that shelters and high-density rescue groups have increased risk of FIP because the coronavirus that underlies it is very contagious and it's shed at higher amounts when cats are stressed in shelters. So the best thing we can do to prevent FIP is not put kittens in the shelters and put them in low-volume foster groups, 1 litter per foster home, not having a foster home with 30 litters, because that is where FIP comes from. And it's very expensive and cumbersome still to treat FIP. So even though it's this great advance for us in feline medicine, it's something we can avoid much easier. So the GS medication cure was published for the first time by Dr. Niels Peterson at UC Davis in 2018. Then there were many years where this was not available through a legitimate source in the US. And so the Facebook groups came up and really filled this gap and made it possible to save tens of thousands of cats through good coaching and finding ways to get the drug into the hands of the cat owners that need it. But as of this month, it is now available through Stokes Pharmacy. And so any veterinarian can prescribe it, have it in their hospital. And so they no longer have to be afraid to work with cat owners to save their cats. So this is the good news. The bad news is we do see some reckless use of it, like, oh, people just using it like maybe it's FIP, maybe it's not, we'll just use it. If we do that enough, the virus will become resistant to our therapy and we will be back to not having a treatment for FIP. So work with veterinarians. Your private practice veterinarians may not be very familiar with this yet. So give them the information, this link here on Stokes Pharmacy. They've got great CE there and all of the step-by-step information about how to treat FIP. So you can help the veterinary profession become more aware of this new breakthrough. And then I just wanted to go back to vaccination a little bit. The shelter veterinarians have long had a very intensive vaccination guideline for cats in high-risk environments, so especially shelters. And this is another thing that private practice veterinarians may not be familiar with, and it's not taught at most vet schools, so it's not their fault. But we do want, in a high-risk environment, to start vaccinating kittens at 4 weeks of age, which is about 4 weeks earlier than they're used to, and then repeat every 2 weeks until the kittens are 20 weeks. So it's not a matter of how many vaccines they get. It is a matter of how the age of last vaccination, when we know they can respond. Now, the risk in a low-risk foster home is not as intense as in a shelter, so we can back off on that intensity. We do not need to use that shelter protocol in all foster homes. So the guidelines say to back off into every 2 to 4 weeks, same duration of vaccination. But also, I would say, in my experience, most well-run foster programs are vaccinating about every 3 weeks while they're in the home.
So in closing, I know our time is getting short and we're cutting into our Q&A. It's really important. The reason that we decided to do this and got together to create this is we really need to make things easier for fosters with this huge amount of kittens coming in, and how do we deal with them? We want to do that without compromising care. So we do that through research with our shelter medicine programs, and we do that through developing programs that support fosters and allow shelters to do their work with limited resources. We know know that there will be mistakes and accidents along the way. Anytime you introduce a higher number of cases, that's just going to happen. But we do people a disservice when we don't talk about it, because we can all learn from each other's mistakes. We do have, Kitten College has a page it's called Kitten College Community on Facebook. It is a closed group, and it is just for shelters and rescues and shelter vets, anybody who's working with kittens, to discuss questions and share their mistakes and share theirs, so we all can learn from one another. I'm sure that things like that will start to evolve. But one thing to think about that worked really well for Kitten College, and why our program at AWLA did so well, is we categorize our fosters by class. We have freshman, sophomore, and junior and senior fosters. So when a kitten comes in and it's a certain age, we know which shelter, or which foster it will thrive the best in. It allowed us to give the fosters the ability to determine their own foster experience. It also allowed fosters to say, hey, I'm going to be traveling in 2 weeks, I can take it, but then it can go to someone else. And what we also learned is that the socialization impact of moving those kittens at such a young age made them incredibly resistant to getting sick. So it's important at the young ages, if they're not sick to begin with, to get them into different environments and trying different things. And the proof is in the pudding. We have these amazing kittens from our program that are essentially dog-like kittens. They're not, there's not a lot of fear. Anybody who's interested in learning what we did at Arlington to make those changes, Kitten College offers all those resources for free. Mostly we just say support your fosters and support one another. So we have contact information now. Should you decide to learn more about what Dr. Levy is doing at the University of Florida, here's a QR code to her website. And the same for Kitten College. We have a very active newsletter that sends out information like these panels that we do, or where we'll be in the country. If there's someplace that you want us to go, you can also contact us on social media. We literally just launched June 1 as the national, so we're just building. Please support us and help us in any way that you can, and we look forward to doing the same for you.
Wow, I am blown away by all of this information. I got to tell you all, I am struggling to keep up with all of the Q&As coming in. You are absolutely overwhelming. I have a bunch of my own questions, but I'm going to be thoughtful and try and get to as many that we have in the chat here as possible. Remember, folks, we are not going to get to all of your questions, so please pop over to Maddie's Pet Forum, and Dr. Levy and Marnie will do their best to get back to each of these, because we cannot answer all of these even if we stayed all night. We've got, I don't even know where to start. We're bouncing all around here. Let's see. Boy, people are adding questions to the chat faster than I can keep up with them now. Where did we go here? Do we have a protocol on feeding sick or unthrifty kittens that you can talk about? Is there a different protocol than that's available?
Absolutely. So now the reason we said at the beginning of this is for healthy kittens, because any sort of compromised kitten will need a specific vet plan. So if you have a kitten that is, if it's something as simple as diarrhea, it may not be that different. But if it's something as like calesi or something that's really aggravating their intake of food, and a vet will have to determine what that is.
Gotcha. All right. Do we have a resource? This comes from Marcy. Is there a resource out there about a formalized training program for educating neonatal fosters at a very high volume? Is that something that the Kitten College has a resource for?
Yes, and that is something that we did with Maddie's fund. Essentially, it's called Taking the Fear Out of Bottle Feeding and Basic Kitten Care. We have that, but we're also working on other things as well. We also travel a lot. We're on the road a ton. I love that we do this over computers, but there is nothing like in-person training. And so we travel probably 3 times a month. We're out on the road somewhere in the country doing these classes in person. So if you want one in your community, please let us know. We work with lots of corporations that help us fund that, so that the onus doesn't fall on the shelter or rescues. But we just need to get people there. So if that's something that is helpful to you, absolutely let us know.
All right, Dr. Levy, this one's coming your way and is also near and dear to my heart, so bet you can guess the topic. This comes from Tracy, and she says, I know IDEXX is the most widely lauded test for feline leukemia, but can you comment on the accuracy of the Zoetis ViraCheck ELISA kit? It's so much more economical and easier to run 10 to 15 kittens at a time. We're running into this problem because IDEXX costs a bunch of money. Can you talk about that, please?
Yeah, good question. So the ViraCheck kit would be a plate test, and there's also one from IDEXX as well. And those tend to be very accurate if they are performed properly. They're much more prone to user error, however, because washing that plate is those wells has to be like really well washed. And so we can get false positives if they're not completely washed. But it is a very good test, it's been around for a very long time. So I would use those in volume situations for sure if you are certain that your technicians are well trained.
All right.
They also have the witness test, which is pretty cheap. It is my second favorite test. And so Zoetis has that. And so that would be the other one. And the other thing you could do is if you get a quote from like witness, you can take that to your IDEXX person and they will match it often and give you a very good deal on your SNAP test as well.
Excellent. Okay, this one comes from Mallory. How long does it take stomachs to stretch to transition to feeding them less often? Do we know?
Basically, it's a good question. It's about the kitten and when they wake up. So we see some kittens and we hold up and it looks like a pear and it looks like a real fat pear. That kitten, it can hold some food. Not all can. So usually if I get a kitten that's, 1 week old, I will start it at, every three or 4 hours. Longer sleep, they will be able to take in more on the next feeding. So that's really when you start seeing it. I would say about probably 24 to 48 hours. And another thing I wanted to follow up with on the last questions, I'm sorry, I saw in the text, a lot of people have been asking about it. Kitten College will help with program development, and we have an informational meeting about it on July 17th. That will be a Zoom, and it will be that will go out in our newsletter for if people are interested in that part of it, just to see if it is a good fit for you or if these resources can help your organization.
Okay, I've got an anonymous question that is on the sadder side of things, but I think we're specifically talking about, shelter medicine and real world protocols when we're dealing with high volumes of kittens. And this viewer asked, is there a developed guideline for euthanasia based on variables that would predict immediate viability at intake, such as body condition score, temperature, etc.? We struggle to guess what's stable enough to send out to foster and what's past the point of viability and will likely die immediately in foster care. And we would like some guidance on that decision making.
That's a great question. And I can say that there is no evidence-based guideline that I've come across in kittens where, you can put your metrics in and say, have a likelihood of survival or not. But I think we're mostly dealing with anecdotes. So kittens that come in really cold, do not respond to care, or the ones that I see that get hypoglycemic and you give them glucose and then they're instantly hypoglycemic again. And it's just, you can't keep their blood sugar up. With multiple treatments, I've had lower success in those kittens that you think are septic or have other evidence of infectious diseases. I think when you think you have failure of passive transfer to kittens, and so you have one kitten after the other within a litter that die, often very suddenly from sepsis because they didn't get antibodies from their mothers. Those are all ones where you can predict the chances of their survival are lower. Can you pull some of them through? Of course. I do think that we underutilize humane euthanasia in this group of cats. Partly because it's just not available, right? If your fosters are dealing with a fading kitten in the middle of the night, if you don't have staff on duty that can euthanize a kitten, and you can't really make arrangements with a local emergency clinic to euthanize it, it's really hard to have access to that care. And I do think those kittens are suffering. And so when we see shelter statistics that have a high rate of died in care, I feel like we're not utilizing euthanasia enough, because those kittens, even though they might look peaceful, fading away, they're undoubtedly suffering. So I wish I could give you a matrix that we would all want to have to know that we're making the right decision. But I don't have that. But I do think we all need to have a protocol so that kittens can be euthanized in a timely manner when we do decide it's necessary.
Okay, we have a lot of conversation happening about vaccines, and I'm going to try and roll it into one conversation to address as many people as possible. We've got a lot of pushback to starting vaccination at 4 weeks of age. We've got questions about what if they're sick? Is there ever a time to delay that vaccine? And is it going to cause some false positives on my parvo snap test? What do I do about that?
All right, well, those are actually the easier ones I can answer if I could have come up with this topic. So parvo positive snap tests, very, very rarely, probably not on a snap test. We've done that research, and there's some other brands that aren't even made anymore that we did it. You will get a false positive on PCR though, so know that for sure. It's much more sensitive than a snap test, so don't worry about it. Yes, we would say vaccinate all kittens, even if they're sick, and because it's just so essential to try and give them that protection. And what was the first one? Should we, like, they're having trouble getting the 4-week
Starting at
buy-in
4
for
weeks.
that. And it's just
Mhm.
like, you have to send the vets to us for your shelter medicine programs to talk to them, to show them the data. Panleuk outbreaks are just everywhere, and they're plentiful, and they are slaying kittens. And we know that we can really put a dent in the risk of those for the cats that didn't get interfering antibodies from their mom. And unfortunately, we don't know which ones those are. I did not tease the information that's coming out now from Wisconsin and Davis, but I saw someone did it for me in the Q&A about maybe vaccinating even earlier in very high risk situations, as early as a day of age. So stay tuned for more kind of shocking new information coming out around that as well. But the summary is follow those guidelines that ASV has written up. They're evidence-based. They are incredibly powerful in protecting kittens. And if you need help getting your vets on board, connect them with your local shelter medicine program.
Okay, we've got clearance to go a couple minutes over in time, so I'm going to try and get through a couple more questions here, but we'll be really respectful of folks' time and try and wrap this up quickly. Let's go to FIP. One of the questions asked, can I have that FIP kitten in treatment around other cats?
In theory, you can. In theory, FIP is not contagious to other cats. The coronavirus that underlies it is very common. It's very contagious. But then there's a mutation that happens to that virus in the kitten itself that stops the shedding in the feces and turns it into a systemic disease. So in general, we do not consider FIP to be infectious to other cats. There are exceptions, though. So there was the big outbreak in Cyprus, the country of Cyprus, the island, that definitely was spreading because of a mutation there. We have seen sometimes little epidemics in shelters or breeding colonies of cats or catteries. And that's just a freak kind of mutation of the virus there. And then we also will see clusters within related cats, so within a litter. And so that is a genetic predisposition to the virus. And whether each kitten got its own mutation or whether they spread the mutated virus among the kittens in the litter, we don't really know. But I think I would manage it as not contagious.
Okay.
How about you, Monica? You've got a lot of experience with this.
I always tell folks that it is not contagious, and it's, in my mind, because I'm not as smart as Dr. Levy, I imagine it, I picture FIP as a mutated gene, and like I can't catch that. So I'm happy putting those cats who are in treatment with other cats. Yeah. Marnie, I want to come back to you. So look alive.
Okay, here I am.
Some questions and clarification folks are looking for on this concept that we do not need to feed every kitten every 2 hours all night long. And we're really losing fosters by setting that expectation, right? That you're going to be up all night long. I don't want to do that. My fosters don't either. So if I'm a shelter though, what do I tell my fosters? I can't just tell them you're a heavy sleeper. Yeah, just go to sleep and sleep for the next 12 hours. Is there some sort of standard or minimum I need to tell them to set an alarm throughout the night to check them?
Right. So there are very few cases that you would have more than one. I can't imagine a situation unless the kittens were sick that you would need more than one feeding in the middle of the night. So if you have to set an alarm, that's fine. Wake those kittens up, feed them. Do know that when we see a higher rate of suckling with kitten. People blame it on, oh, they're suckling because they're hungry, they're suckling because they're hungry. And that absolutely can be how they start to suckle. But suckling is self-soothing for kittens. So you see kittens that will take a bottle and go back and start suckling again. It is the act of self-soothing. So if they wake up and they're hungry, they may rat around, and that may be how it starts. But you need to be very aware of separating kittens early on if that happens. So I would say to the question, do set one alarm through the middle of the night if you don't hear them. What I normally do is I keep a little carrier by my bed with the kittens, and I live by the Pentagon. A bomb could go off and I'd sleep through it. But if I heard a kitten mew from 2 doors down, I would hear it. If people aren't that lucky, then set an alarm for your own health, but make sure you get the sleep. You're not going to want to do it if you don't have a positive outcome. And if kittens wake up and they're a little bit hungry and you're not getting up for another 20, 30 minutes, that's okay. Hopefully they'll wake up when you feed them, and they'll go right back to sleep. But know that if you wake them, you feed them, they're highly likely to start routing around to suckle to self-soothe themselves back to sleep.
And I want to add a comment here in the chat from Nicholas Shields that when it goes back to how do you know if kittens are viable or not? And this is a really good point. Writing, rooting, and suckling reflexes, as well as age-appropriate weight and temp, are how we gauge viability. So I think those are some good starter points to use.
That's a good one. Okay, let's go. Last one, and then we're going to have to wrap up, unfortunately. Let's go back to Panluke for a second, because there's also a lot of activity surrounding the concept that we've started talking about, that once you had a Panluke foster in your house, you could foster non-Panluke kittens again. And a lot of us have been taught that that is not a thing, that once a Panluke home, always a Panluke home. Where do I go to find resources and information? So how do I sanitize my house as if I've had a Panluke as a foster, and how long afterward do I have to wait before I can have more foster kittens?
Well, I can tell you what we do, and Dr. Levy probably has some insight on this as well. We do it based on need. Okay, so if we have fosters that are amazing fosters, and we really keep our fosters with areas like we don't recommend using carpet or any sort of porous surface. But we will send home rescue with them. We will send home. There are lots of options for the proper way to sterilize an environment, and we have them go through that several times. Let the area air dry. Another great killer of bacteria is sun. So if you have stuff that can be dried in the sun, that's another great way to kill ringworm and other bacteria. So what we would normally do then is, if we have kittens we can't take because there's a foster home that may have had Panluke, but we know that we trust the foster and we know that it's sterilized the best it can, we will pull those kittens and give them to that home.
Awesome. Okay, I lied. There's going to be one more because I like this question. In Panluke survivors, do you continue to administer FBRCP vaccines after they're fully recovered?
That's a good question, because those survivors are immune for life, probably. And so, but the other vaccine, there's other components of the vaccine too, besides the Panluke. So yes, we would continue to vaccinate them. But lucky them, they're probably never going to be at risk for Panluke again.
Okay, I am told that we have to wrap it up, even though we could easily continue this conversation well into the evening hours. We hope that you learned a lot from this webcast. Dr. Levy and Marnie will be available on Maddie's pet forum to continue this discussion. We promise we're going to get to as many of your questions as we possibly can. Feel free to post all of your questions over there. Thank you both to Dr. Levy and to Marnie. Thanks to all of you for being here today. And thank you to Maddie's Fund for making this content possible and helping us save cats and kittens every single day.
Thank you to everybody out there who's doing this hard work. It's a hard year, incredibly rewarding and sad sometimes too. So we appreciate you.
Thank you.